Howdy, folks. My name is Derek Bourne. I teach English at Coconino High School in Flagstaff, Arizona. I hope everybody had a good 4th, a safe 4th. And I wanted to talk about COVID-19 and children specifically because the facts on the ground seem to be changing pretty quickly right now. And there is still a lot that we don't know, but a lot of the new information that is coming is pretty disturbing, in my opinion. Or certainly cause for concern. So one thing that I think really made a big splash recently was this call from pediatricians to go to in-person school. As with most things in the headlines, it was kind of stereotyped a little bit, but they did come out. They did come out very strongly for their positions. They do say the goal should be having students physically present in school, right? Notice that is the goal. That is the aspiration. They aren't indicating that this would be divorced from science or other considerations. It's just what they think is best. And I think we all basically agree. But then they do point out that reentry policy should be nimble in responding to new information. That's part of what I'm trying to do today is kind of give some of that new information. There's been a flurry of news stories just in the last week that have really started to paint a different picture of COVID and children and schools and daycares. And you'll notice they also state you should adapt your policy depending on the level of viral transmission in the school and throughout the community in collaboration with state and local public health authorities. And unfortunately in Arizona, where I live, the local health authorities appear to be somewhat cut out of the picture. They have not gotten any clear guidance from the state at this point as to what those clear criteria would be, what level of viral transmission would cause or force them to close or, cause them to make the call that schools should shut down. And some of our public health authorities at the local level are pretty frustrated with that. So they also urge us to consider the mounting evidence regarding COVID-19 in children and adolescents. Again, that's part of the conversation I'm trying to contribute to. Now, they do point out children and adolescents are less likely to be symptomatic and less likely to have severe disease. The symptomatic thing is actually almost concerning because we know that this would allow kids to fly under the radar and potentially contribute to community spread without knowing it and without anyone else being able to know either. The less likely to have severe disease is, of course, a great thing for the children, and we all have to celebrate that this disease just doesn't work like many of the other coronaviruses. And I'm not going to present anything that will really change that assessment, but it will show that it's not as simple as it looks. And then it says children may be less likely to become infected and to spread infection. That is what I think we're starting to be able to cast some doubt on, and so let's get to it. So some of the older evidence was that, children are less likely to be symptomatic, become severely ill, be hospitalized, or die. That is still true. I don't have any new evidence that really contradicts that one. And then this concept that kids do not play a significant role in transmission is something that needs a lot more study, but I'm going to show you a whole bunch of recent articles that start to call this into question. So first, though, Slate put out a really good article, The Medical Case for Reopening Schools, kind of echoing what the pediatricians organization was saying, that, because of the important role that schools play for kids' health, we need to do it. So they claim that COVID doesn't seem to be much of a pediatric disease. Now, so far from older data that is true, but again, we're going to see that is starting to shift in various states. They do admit, though, in Slate, that closing schools may be worth considering in order to protect the adults who work in them. And that is something, of course, we want to just keep in focus as well. We're trying to protect not just the adults that work in them, but also the community members that those kids would go home to and potentially cause them to get sick and some die. So they asked the question, are adults really at risk of getting COVID from children? We don't have amazingly good information on that yet, but I'm going to show you some stuff that indicates that it might be happening more than it was before. And then we don't yet have a great answer on the final piece, that very few transmissions appear to be from child to adult. That is hard to prove, but I will just say this. Most of the evidence that has been looked at to try to answer that question of child to adult spread is from a period of time, from let's say January worldwide through May, when most schools and other facilities that kids would have been going to on the regular were closed to kids. Or if they reopened, in most European countries that reopened, they did so with staggered schedules and much smaller class sizes in most cases. So again, we just don't have great information about what this would look like in an active school setting without social distancing. The Mayo Clinic on July 1st, just 4 days ago, put out this kind of column with information about COVID in babies and children. And I just wanted to highlight a couple quick things in here. Again, this is from older information, but it shows that between February and April in in the United States, it is true that only 1.7% of cases were in children. So again, we do see so far that had been low, but you'll notice that is a couple months ago, and I am eager to see new data on that based on what I'm going to show you today. And then here's the China fact that a study in China, again, December through February, so not too recent, showed that just under 11% of infants that got COVID had severe or critical illness. This is a bigger number than I had realized. Over 10% of all infants, have a severe or critical issue that they need to go to a hospital and take a look at. And it actually turns out they think because kids have less mature immune systems, infants and very small children, that's why these numbers then kind of decline. But it's still 7% severe or critical for kids 1 to 5, and then it drops to 4% for 6 to 10-year-olds. And 4% for 11 to 15. Finally, when we get to the high school, middle and high school, we do really see that it's, fairly low incidence. But concerning levels of severe or critical illness, I would say for some of our young kinder kids. But so we now see that our youngest are at least more at risk than older children for severe and critical illness. And that's something I just hadn't really noticed or paid attention to. All right, so let's get to the actual new cases of this kind of spread that we're seeing recently that looks a bit different than anything we've seen before, and what can it tell us? So first, there was a study that just came out 4 days back, July 1st. Children can transmit COVID like adults. And this was published on the CDC website, so it could be assumed to be a credible source, a credible study. The University of Geneva and their hospital system surveyed kids that had COVID, young children 7 to 16, and all but 2 carried the same amount of virus, or what you might call viral load, as adults. So these researchers say that children should be considered as transmitters unless proven otherwise. If they're carrying the same viral load, then their breathing and talking and singing or any other vocal activities would be very likely to contribute to transmission. And this is one of the first studies that we've seen that was able to take a look at this in a clinical setting and actually measure the viral content of children and kind of what they shed, I guess you could say, as they engage in various activities. So then, again, from the same day, 23 students and 8 staffers tested positive at a boys' school in Queen Creek, Arizona. This is a boarding school, and so some people will say, oh, well, that's not representative of a typical school setting, and that is absolutely correct. It's different. However, they interviewed an anonymous staffer there, and first of all, this is just, to me, kind of concerning. Staff members who tested positive had 2 options: work in a quarantined cottage with students who also caught the virus, or use your own paid time off for 2 weeks at home. We're going to see these kinds of realities if we go to in-person learning in schools, in terms of people having to use up their time off for potentially severe illnesses that they were put in a situation making them far more likely to catch it than they would have been. I mean, I know colleagues that have not left their own house except, well, I know some colleagues that haven't left the house at all except for to maybe walk in the woods or something like that if their house abuts the woods. And then, anyway, yeah, so there's just going to be a lot of people put at risk that they would not have chosen for themselves, let's put it that way. But you'll see that the school said, I mean, if they can be trusted, that this school said that all students were kept on campus unless there was an appointment mandated by the courts. So these kids weren't even leaving this boarding school except for court-mandated appointments, and yet all of these staff and students managed to get infected. So that's just should be concerning, I suppose, for anyone trying to figure this out. And this wasn't the first, because actually in May, there was 100 positive cases at Mingus Mountain Academy, also in Arizona. And of those, 86 cases were between the ages of 13 and 17. So, I mean, it looks to be quite a bit of spread among the children and teens. So we have this type of situation, but that's not the only way that we are seeing more and more documentation of spread among children. So here we have, from 3 days ago, Fort Worth, Texas, Cook Children's Hospital. They're seeing a spike there. And it says at the bottom of this screenshot that about half of the new cases in this children's hospital are just in the last week and a half. Again, indicating that something is changing in our country and across various states as community spread in general grows, that we're starting to see that really kind of trickle down to children and possibly spread among the children as well. The doctors in this article warn that kids can still spread COVID. And then at the bottom there it says anything where you're closely around other people, we think the virus could easily spread in those situations, even when you're doing your best to wear masks. Obviously, this is very relevant to our school settings, where almost none of us will be able to practice the recommended CDC social distancing or physical distancing guidelines. Then we see in Alabama an increase in hospitalized children from COVID. And again, you see at the bottom, this is specifically over the last several weeks, so this is kind of new information that's breaking right now. And this person says the best way to protect your child is to protect your community by social distancing, density reduction, and wearing masks. And those first two pieces, social distancing and density reduction, generally our return to school plans are not allowing that to an appropriate level. And here you also see a nice statistic to shed some light on this. 20% of the state's COVID-19 cases have been in people ages 24 or younger. And that accounts for just under 8,000 young people. That's quite a bit of spread. And then this is also recent from the same date, July 1st. Oregon, we have coronavirus rising the fastest among kids younger than 10. And you can see in the headline that it's causing Oregon to seriously reconsider their school reopening plans. The cases among these young kids grew fivefold during June, which was the fastest growth rate across any age range. And the officials said it's largely due to unidentified transmission within the community, which is what a lot of American states have right now, is just generally widespread transmission. Then they say, although outbreaks at daycares also are playing a small role. So here we have public health officials identifying daycares as an actual source of community spread and outbreak and contributing to this rise, which again, let's think of how much daycares resemble schools in many cases. LA County from 2 days ago is seeing a spike of COVID cases in children. And this is what they're calling their second spike of cases in general, because they had kind of, flattened the curve for a while. It says cases among children have jumped more than 50%. It's not just the number of cases, but it's the number of cases where, typo, children are seriously ill and requiring intensive care units. That is obviously very concerning. And, we might learn more about how this disease actually functions in children. It's not what we want to be learning right now, but with more spread, I guess we're going to find out kind of how this thing really impacts children. And they're jumping in Florida as well. This is just from yesterday, July 4th. And this article tells us that Friday set a record in the 19 or younger age group, over 1,100 cases for the second day in a row, and it's the highest number of cases among that young age group they've ever had. And if you've been following the national scene, you know Florida is an absolute hotbed in general right now. The last stat from this that I'll read is that in Friday's numbers, among young Floridians, it was 24% case positive. And so, again, just very concerning, and the kids are looking more like the adults now in terms of high positive rates and just high caseload overall. So we've established that, the numbers are rising quickly in several states, and who knows what we'll see in the next couple days. Then we go specifically to daycares. This was looking good just a couple weeks ago. There were some stories about, the YMCAs that had had so few cases across all their states, but it's important to note that they had instituted really good social distancing guidelines and were able to limit their class sizes to, I believe, 9 in most states that they operated by expanding to nearby facilities. And that's something that our schools are just generally not going to be able to do. So I think now we're starting to see cases that look a little more like, the concerns I might have about schools reopening. 300 children in Texas daycares have caught it. As you see, the numbers are rising. And there's actually 950 reported positive cases. Now take a look at this in daycares. Child care centers of various kinds. So you got 307 children and 643 staff members across 660 child care locations. I'm sure it doesn't really play out this way like an average, but that is literally almost one staff person per child care center. It is, about half a kid or one kid for every 2 child care centers. Now we can assume that there's probably a lot of clusters that are centered in various individual facilities, and well, yeah, it shows right there actually. There's 668 locations with COVID spread out of 12,000 total. So it's by no means, at every facility, but what is that, 5%? Yeah, 5% of all of their facilities have some sort of confirmed case. And look at the rise from 59 cases in mid-May to 576 on June 23rd. And who knows what it is today. This article just came out and that's what they were able to report. One thing I want to point out too is a lot of states have not really mandated good reporting around what they call congregate settings, which schools and daycare facilities, prisons, and other places where there's masses of people regularly. And whether for privacy concerns or whatever reason. So we haven't really had good information in a lot of states until more recently. Here we have a cluster of infection at Mecklenburg Child Care Facility in North Carolina, just from 2 days ago. And, that's kind of hard to read. So the report announced that the state would begin reporting the clusters, which are considered 5 or more cases, just recently. This is the first time that in North Carolina that they're actually reporting clusters in a way that you could see it spread at these facilities. So you see here that it's 5 different facilities and a school in North Carolina have just been revealed as spreading centers due to these recent changes in reporting. And then we have a YMCA camp in Georgia that closed. This is just today after folks tested positive. The counselor who tested positive did pass the mandated safety protocols and did not exhibit any symptoms upon arrival. So, this is just pointing out that asymptomatic spread that we all know is documented and can happen. But as you see, unfortunately, additional campers and staff have since tested positive for COVID-19. And they don't give us a number, and the camp refused to provide those at this time. So quite a bit of recent evidence is just emerging about these outbreaks at daycares, children's summer camps across various states, especially and unsurprisingly in the states that have the most spread. And we all know that per population, Arizona is leading the pack on that right now, though Florida will likely catch up with us very soon and surpass us at the rate they're going. Okay, so then kind of one last study to look into here. This one is a little different, more looking at how super spreading takes place. And what was interesting about this study when I looked at it is they were able to get Facebook data, Facebook location data that was anonymized. And so they were able to kind of identify these people who tested positive and trace them back to having been in the same location for periods of time. It's one of the first real big looks on a statewide level in Georgia about how super spreading might occur. And what they found was a bit freaky, that basically 2% of infected people total looks like through the location data directly infected, about 20% of all the people with confirmed cases. And then they even found a handful who appear to have infected 15 or more people. Now, when you think of one person infecting 15 or more people at whatever events these are, it just again highlights the real concerns and care we need to have about school settings, where close proximity would be the order of the day, especially in secondary schools. Well, it's kind of two different things, right? The elementaries have much more duration of time in close contact with that smaller group, and then the high school and middle school kids have much more diversity of different people, where they're exceeding the 10 to 15 minutes of safe time, and exceeding the recommended distance guidelines. The one other thing to point here, and the study's authors lamented that they couldn't really disaggregate the data further to give you a clearer picture, but they said the age group that spreads COVID to the most people is not Georgia's elderly. They found that children and adults under 60, which really just meant all people under 60, were nearly 2.4 times more transmissible than those over 60. And they said at that time there wasn't quite enough reported community spread among kids in Georgia over that time period to disaggregate by just young people, like just 16 and under, or that kind of thing. The numbers were too small to have yielded good results. So this is just, I guess, generally suggestive that young people younger than seniors are spreading it a lot more than seniors are generally. From the study itself, they said that super spreading is an important and ubiquitous feature throughout the pandemic, and this was again the first statewide study to really establish this. They had a couple tiny little graphs that wouldn't have really shown up well on the screen that really showed like this, this upward trajectory over time of these super spreader events. And then they conclude that the increasing significance of super spreading over time also highlights the importance of maintaining social distancing measures that may curtail close contacts. That is, again, what our schools are generally unable to do, in, with crowded classrooms. So we see, this concern about super spreader events. And then we still don't have great information on how much children are really contributing to the overall spread or to the specific child to adult spread. But that one study that just came out the other day that indicates that children have the same viral load as adults certainly is highly suggestive to say there's no reason children wouldn't be spreading to adults or wouldn't be able to spread to adults just as much, and that every infected child wouldn't be just as likely to have a reproduction rate of the disease, at whatever it was like at in the community. One other thing to keep in mind with this, in terms of just the uncertainties right now, is another reason child spreading may have looked low up till now is a lot of families that I knew were kind of quarantining their kids, pretty significantly limiting any of their social contacts. And that has perhaps started to wane along with the adults, in the 20 to 44 type age range who have so exploded recently in their infection rates, as maybe all of us are getting somewhat tired and exhausted over, all these restrictions on our social life. Perhaps that's part of what's contributing to the children spreading it as well. Okay, so one final thought here. Harvard Medical School just giving some advice on coronavirus and kids, and I want to kind of leave you with this. They're answering a question about babysitters and childcare in the house, right? How can I safely do that? And they say, the truth is that the fewer people you and your children are exposed to, the better. I mean, just putting it plainly. And then kind of asking about, well, how do I get my kids some sort of recreation or joy in their life? And they say, ideally, to make social distancing truly effective, there shouldn't be play dates. If you can be reasonably sure that the friend is healthy and has had no contact with anyone who might be sick, then playing with a single friend might be okay, but we can't really be sure if anyone has had contact. And you can just see here the contrast between what schools are being asked to do and the families of school-age children versus the advice that we're giving in general, and it seems, to me, it echoes kind of what you see as well with recent news stories of teachers and administrators getting COVID at, PD, summer professional development, and those kinds of things. Here we are, most of our schools still holding every single meeting virtually. Still, even, I know my district, the start of school events, whether the new teacher orientation is going to be virtual. The welcome back events are virtual. And so it's kind of this, this cognitive dissonance between recognizing the danger and doing everything we can to limit the spread when the adults are involved, and then trying to just hope and pretend and pray that the children somehow are going to be immune. Yes, we do know that they are less likely to actually get sick and less likely to show symptoms, less likely to be hospitalized. And I feel confident, based on the information so far, we will continue to see that be the case. But we don't have any reason to believe that a good number of them won't be able to still get sick, whether they know it or not, and transmit it among the people who are more susceptible, whether, middle-aged, older people with comorbidities, you name it. So I just wanted to kind of make sure that more people are aware. I've been surprised this last week or so about kind of how much new information is just flooding across my social media feeds, and I Googled to find some of these as well, just to see what I could find in the last week, and I couldn't believe how many stories are starting to emerge. So I really just urge us all to keep a close eye on this over the next couple weeks and see what else we can learn and confirm. And I just think we need clear guidelines. We need clear guidelines, and I think that's what my next video is going to be on in a couple days. It is time for us to just demand safe schools for when we reopen, and that means clear criteria, and so more on that next time. And until then, be safe, be healthy, take care.